Most parents experience some kind of sleep problem with their kids. And if you ask a parent who is expecting their first kid what they are most nervous about, much of the time it's that they're worried about how they're going to deal with their own sleep deprivation. And I also hear a lot of new parents say that one thing they made sure to do to prepare for the arrival of a new baby is to read up on sleep training before the baby comes. I know how important a sleep schedule is to the health and happiness of a family. So this is advice I often address with my families who are expecting their second child. I always make sure the older kid is easy to put to bed and doesn't have sleep issues, because one of the most challenging things to deal with when you bring a new baby home is when you have an older child who won't go to bed easily at night, because now you've got two kids to deal with. I hear in clinic about long, drawn-out bedtimes and kids climbing out of their cribs, sleep regressions, and refusing to nap. And I know these are really frustrating problems for parents, but there are easy solutions to each of these issues if you know what to do. In this episode, I talk with sleep consultant Lexi Rupert, who owns Little Bird Sleep Consulting. She's a parent too, and she's struggled with her own child's sleep issues, and she's going to share her story and answer the most common questions I get from patients about sleep. I'm Dr. Wendy Hunter, and I'm the pediatrician next door. I'm that doctor friend you call for practical advice about your kid's health. I mix the science of medicine with the reality of parenting. When families are expecting a new baby, they often tell me they went to their prenatal classes and they did all the traditional things. But more and more often, I hear that parents prepare for their new arrival by reading up on methods for structuring their kids' sleep. And just as often, parents have a plan and things don't go the way they expect. Partly that's because the structure of sleep changes based on a baby's developmental stage and their age, and partly it's because every baby has a different temperament. Here's the advice that Lexi Rupert from Little Bird Sleep Consulting shared with me. What can parents do in the first 3 months that can set the stage for sleep?
Great question. So during the first, few months of life, the primary focus is, of course, to nurture your healing process if you've given birth and nurture your baby. Establishing a feeding routine and starting to offer your baby consistency can be very helpful. So at 6 to 8 weeks of age, I actually recommend at that time you start offering your baby at least 2 bassinet, crib, pack and play naps a day. This just means you're placing them down when they're sleepy or about to fall asleep and letting them practice falling asleep in that space. And then you're there to greet them when they wake up. Offering daylight exposure, opening the blinds, opening the curtains during the day, and then keeping their sleep environment dark during the night can help your baby learn their days from their nights. It can be really tempting in the middle of the night during diaper changes and feeds to turn on lamps and overhead lights, but I would avoid doing that. We also want to use white noise. I've noticed even with my own children at about 3 weeks of age, that's when I see lights start to actually disrupt them. So I vividly remember my 3-week-old in the bassinet next to me and my husband turning on our bathroom light and him really starting to stir from that. Now, by practicing a couple of bassinet naps a day, this also helps our babies learn to fall asleep without necessarily needing to feed. We all feed our babies to sleep, and cluster feeding is, of course, very, very normal. But offering them the practice to fall asleep without feeding actually allows us to offer fuller feeds when they're a little bit more awake and rested versus when they're really sleepy, thus taking in smaller portions.
Yeah, so during that first month, I know you feed your baby and they just fall asleep. They're comatose. There's nothing you can do about it, right?
Exactly.
But you're saying there's a window sometimes 6 to 8 weeks where you need to start putting them in their bassinet for naps?
Yes, that's what we want to try, starting to really expose them so they're getting used to waking up in that state. It doesn't mean you're leaving them. You're going to them right away, picking them up. Maybe they still need to sleep longer and you're rocking them back to sleep, putting them back down, or you're holding them for the rest of that nap.
So during that age, what about the parents that are oh, she falls asleep and sleeps best on my chest? What are your kind of age guidelines about chest naps?
I would say by 4 months, I like to see 2 crib naps And then usually 1 or 2 contact naps. Usually the end of the day, it's a little bit harder for babies to take a good crib nap or a bassinet nap. So the end of the day, that's when I'm like, okay, if you need to go on errands, you want to take a nice walk, you want a baby wear, save it for the last couple of naps, but try and aim for those first couple of naps to be in a proper sleep space. So by 4 months, 2 naps a day are in that crib.
I love this idea because you're just transitioning them to learning the crib or a bassinet early and having an environment where they like to sleep. I also love your white noise idea because it's very loud in the womb. So they
so
need
loud.
that, right?
Exactly.
And then you also mentioned the light thing because I always tell people like newborns barely have light receptors in their eyeballs. So it doesn't really bother them. But you've noticed around 3 weeks, they start to notice. And then you talked about training for night and day. When does that really happen?
It can happen as early as, well, I would say, 3-4 weeks is when we start to really notice that light exposure really during the day can help. You're trying to emulate, what we're teaching, which is nighttime is for sleeping, daytime is for somewhat being awake. Obviously, newborns, like you said, they're feeding and sleeping around the clock.
When do you need to move your kid out of a crib? Because I have a lot of parents that are like 18 months, 2 years, they're moving their kids out, and then the kids are leaving the bedroom and bugging them all night.
Yes. So I am team crib for as long as possible, but we need to be aware of the maximum crib height limits for your specific crib. Ideally, after 3 years old is preferred because at this age, they can understand then the boundaries around sleep. So oftentimes on this topic, parents think that they need to move their child out of a crib to potty train, but this is not a reason in itself to transition a child out of the crib. In fact, we want to actually avoid doing these things at the same time because they are both big changes, right? So in the beginning of your child's potty training experience, their journey, whatever you want to call it, they're going to need assistance whether they're in a crib or in a bed. They're likely going to need help pulling off their pants, wiping, pulling their pull-up back up or whatever they're wearing, regardless of where they're sleeping. So keep your child in their crib as long as you can. It's their safe place, but we want to be mindful of those manufacturer requirements.
Right. So when you talk about the toddler's room is their safe space, like what kinds of things should ideally be in the toddler's room? Because we're talking about like environment. What do you want to set up? What do you want in there?
We want the space to be dark, but we also know that toddlers can express their fears. They hit a certain point where they can, that imagination starts to take off and they can express, hey, something is scary. We want to be mindful of these things. So if they request a nightlight, I recommend choosing something that is dim, keep it yellow, red, amber, warm lighting. We want it as least disruptive as possible. We also want to, if your child is not in their crib, we want to treat the room as a large crib. So furniture needs to be bolted to the wall. It needs to be safe in case they were to randomly climb something. And I would minimize how many toys and things they have out available. I do think it's okay for them to have stuffies and comfortable items and maybe a couple of books and some of their favorite toys. But if you notice that those things are causing them to stay up later at bedtime than they should be, and you're seeing it reflect in their behavior, then we need to put those things away. But we just want to make it a calming environment. Again, keep it on the dark side. We don't need to make it completely dark because, again, we want to be mindful of any sort of nightmares or things like that. But minimal stimulation is what we're going for.
What about picking the actual time that a child goes to sleep? Because I know parents they say, oh, my child doesn't fall asleep till later. Then a lot of parents are like, oh, I can just tell when they're tired. Like if a kid is tired, are they just going to fall asleep?
Yes and no. Sometimes they fall asleep when they're tired. Other times, no. I feel like there is this window between 6 and 8 p.m. where the child's body is ready to sleep. We are diurnal by nature. So that's when we want to work towards winding down the brain. I think that when a child has a really good sleep foundation, they're better at telling you their sleep needs. And tired cues are less likely to be confused with hunger cues or tantrums or just really general fussiness. We've all heard of overtiredness, right? And it really causes children to fight sleep when they need it the most. They've typically caught a second wind at that point, which makes it difficult for them to settle at bedtime. And then there's also crashing, which is where a child is so exhausted, they essentially just crash. And this can happen, anywhere, anytime. And this happens often when people are traveling or having an exciting day. Maybe you skip some naps. That's totally okay. It's normal. We all experience this, but we don't want this to be your child's daily norm. It doesn't typically yield the best sleep. I kind of see it as we guide our children to crawl, to walk, to talk, and even breastfeeding, which is something that's natural. It still takes guidance. We still need to teach babies how to latch and teach moms how to nurse. So sleep is similar in the way that it often takes guidance and boundaries set by the parent to help their child sleep. But I would say when it comes to actual timing for bedtime, hovering within that 6 to 8 p.m. window, because really, ultimately, children typically don't sleep in past 8 a.m. Even that would be considered a later sleeper. And so we want to give them an 11, 12-hour window, which is why 6 to 8 is recommended. If a child is dropping a nap or they are at an age where sometimes they nap, sometimes they don't, we want to move that bedtime earlier and miss that, beat that second wind. But hovering within that window is usually a safe zone.
It's interesting that you mentioned that humans are diurnal. Is that something that you learned about in your training? Because I think that's a really important concept for us to understand, is that we are attached to this planet and the light cycles, right? So what do you know about that?
Well, it's hard to fight it. As much as we try to, sleep is really not equal 24 hours around the clock. We are receptive to specific times, specific windows, and we know that these specific times yield the best sleep. There's kind of two camps in the sleep world. There's following very strict awake times, and there's kind of more sticking within these windows. I try to mix both and be mindful of both of those. It's very hard to, let's say someone contacts me and says, I want my child to sleep through the night from 10:30 p.m. to 10:30 a.m. Mm-hmm. That's a tall order. It's hard to do because we are fighting against what the body naturally wants. Work with biology. Use it to your child's benefit.
Let's talk about some of the problems now, some of the problem sleep. Parents always ask me why their kids move so much during sleep. What is that about?
Movement doesn't necessarily mean a child isn't getting enough sleep or isn't getting quality sleep. Movement's actually very normal, especially in the light stages of sleep. Of course, if a child is having a breathing obstruction or it's very hot in the room, they're going to move probably more than we would like. But otherwise, moving several times within an hour is actually considered totally okay. It's just the body's way of adjusting itself to a comfortable position. We move frequently too. We might not recall it. And we're kind of hyper-focused maybe on the baby monitor, or if you have a child next to you, you're kind of more focused on that. But we, as adults, might toss once and resettle. And our children, it might take them a minute or so, or they might literally sit up, babble, and then go right back to sleep because they're still asleep.
Right. So parents shouldn't go in and get them if they're doing that.
I would not. Let them do their thing.
Does teething really interrupt sleep? Do you think it does?
Most of the time, no. Unless they're having fevers or rashes, teething is sort of blamed for a lot of sleep disturbances. But the thing is, when a child has a really good sleep foundation, think about it. That's really the time that they're getting relief, is overnight when they're asleep. When the gums are swollen as the teeth are emerging, that's typically the most painful part of teething. But children are losing and growing teeth for many, many, many years. So I recommend, if your child is struggling with teething and you're seeing that they're very fussy, freeze some wet washcloths, offer some frozen teethers before bedtime, and let them gnaw on that while you're reading books. Or if they need it, all day long, allow them to chew or gnaw on something that's nice and cold and frozen.
I'm so glad to hear you say that, because that's what I tell people too, is that your child is going to teeth from they're couple months old, 6 months old, whatever, until they're 4.
Yes.
It can't possibly have that much of an effect on them. It's constant.
But then after they even lose their baby teeth, they're still getting those adult teeth in. And we don't really hear about children that are 7, 8 years old plus waking up from their teeth hurting.
Right. It does get blamed for a lot of stuff. All right. My next myth that I have no idea how to frame this for myself, but parents tell me all the time that their child's having sleep regressions. But I hear it at, oh, he has his 2-month regression, his 3-month regression, his 4-month. There's like every month has a regression. So what's the real story with sleep regressions?
This is a fantastic topic. I think the biggest one we hear about is the 4-month, and then we got the 9, 12, 18, 2-year. I hear the same exact things. We do know that there are predictable times where we see that sleep disturbances occur, but these are more relative to windows. So it's not like the 4-month regression happens exactly at 4 months. It could happen at 3 months. It can happen at 5 months. But what's really going on is your child is just rapidly developing. So typically what we see is there's a skill that's being developed. Are they pulling up to stand? Are they going through a language explosion? Are they starting to walk? The best thing we can do is practice these new skills during the day. So if they're crawling, you're really prioritizing that tummy time. If they're pulling up to stand, you're spending time with them on the ground, helping them learn this new skill. It's very normal for sleep to be temporarily disrupted as they're learning a new skill, but a regression, which is really a progression, is only going to last a couple of weeks at most. It's not going to last 3, 4+ weeks. If sleep is haywire, there's likely a new habit that has been formed. At that point, I would be looking more into whether their sleep schedule is right for their age.
Okay. Yeah. So they need to call you.
Yes.
Just a handhold. All right. Here is my next challenge for you. So you have a 2-year-old and they're climbing out of the crib. What does a parent do? What are your strategies?
Kind of circling back to if your child has outgrown the height limits for their crib, they do need to be moved into a bed. And like we mentioned, the room does need to be treated as a large crib. Now, if they have not outgrown the recommendations, I suggest that you put them in a sleep sack. You also talk to them about sleep, as in explaining that bedtime is a time that we lay down, we close our eyes, and we go to sleep. We also want to make sure that their nap is not impeding on their bedtime. It could be too long. And typically at 2 hours of daytime sleep is plenty. So you may have to wake your child from their nap. And if they're not napping, let me first say at 2, they do still need a nap. So keep offering it and it will return. But if they skip a nap, we want to offer them a really early bedtime, even as early as 6 o'clock, 6:30 is totally acceptable. So we avoid that second wind of energy before bedtime that we've all experienced. The benefit of using a sleep sack and the purpose of that and why I recommend that for crib climbing is basically after you drop the swaddle, move your child into a sleep sack, and it really prevents children from getting the footing to escape the crib, potentially getting hurt, and then prematurely having to move them into an open bed setting. Also, I know it's really trendy right now to have a crib that is where all 4 sides are the same height. But the benefit of a higher back crib is you can actually flip it around so the higher side of the crib is facing out towards the room, and then the shorter side is against the wall, which also minimizes that desire to crib climb.
Oh my God, that's such a hot tip for moms who are shopping for cribs right now. Get the uneven sides, right? A low side and a high side. Love it.
The traditional, yes.
Next question. Next age. How about that? I just heard this story last week. The parents, they have a 4-year-old, and he said their kid gets up at 5:30 no matter what. So they've tried everything. They tried skipping his nap, but he needs it. They let him extra nap as long as he wanted. They tried a later bedtime, but he gets up and wakes the parents up at 5:30 in the morning no matter what. And he's 4. So what do they do?
So we have to set some sort of threshold or parameter when it comes to when we actually start our day. So for me and what I teach the families I work with, that threshold is 6 a.m. Otherwise, it turns into, well, they woke up at 5:45 and that was okay. And then the next week it's 5:30. And then before you know it, it's like 4 a.m. and you're watching Peppa Pig. So 6 a.m., anything before that, we consider a night waking and we should treat it just as such. So at 4 years old, I would definitely drop the nap and really try to avoid those 4 p.m. car naps because they can make bedtime really, really difficult. Think about how we're also reinforcing that 5:30 wake up. So are we getting up and turning on the TV at 5:30 so we can get a little bit more sleep? Are we offering food? If so, we want to avoid those things. You can't blame your child for continuously waking up at 5:30. We also want to look at their sleep environment. Is there sunlight coming into their room? If so, we want to darken the room. Do they have disruptive lighting? So are they flipping on overhead lights? Do they have really, really bright night lights? If they have a night light, it should be dim and warm. I highly recommend also using a toddler clock for this age. I absolutely love toddler clocks. 4-year-olds also cannot tell time, but they can understand things like green means go. So to use a toddler clock, you'll want to set it for an overnight color, a red, orange, yellow, or amber type color. Then we can choose a wake-up color, something like green, of course. Explain to your child that if the clock is red or whatever that bedtime color is, we are staying in our bed. Red means stay in bed. If the clock is green, they can get up and start the day. We want to build them up though. So at first, I really recommend setting that clock for the time they're naturally waking, which in this case is 5:30 a.m. So set that clock to turn green at 5:30 for a couple of nights. And then you as the parent, I want you to be there at their door at 5:30 to praise your child and congratulate them for staying in their bed until that clock turned green. Allow them to really feel that success. And then after a couple of days of them being really excited about what they've achieved, move that clock 15 minutes later. So set it for 5:45 and then keep doing that until you hit at least 6 a.m. With the right tweak of a schedule combined with the toddler clock, you will definitely have some later mornings.
That is fantastic advice. That's not at all what I told them to do, but I love that gradual method. Plus, I told them about the toddler clock, but knowing how to use it is crucial. And so can you do this like at time changes too, when the time jumps forward or backward an hour and your kids are off?
You can, and you're going to want to be gradual. And some kids are more or less sensitive to the time changes, but you can definitely do that. And we want to just make it attainable for your child. We don't want to make it super difficult for them. But also another key factor here in this being successful is if your child is like, it's red, I don't really care, I'm getting up anyway, you're walking your child back to their room and they do need to stay in their room until that clock is green.
Okay, so
that's the hard part.
And be quiet about it. Don't reward them with food or like give them a game to play with or anything. Just quiet, you're back in your bed.
Minimal stimulation for sure.
You have 2 children with a third on the way. And I don't know at what point you became a sleep consultant, but did you have any sleep problems with your kids?
Between my children is when I actually became a sleep consultant. I would say my daughter I was like 2 weeks postpartum and I kept dealing with back-to-back mastitis infections. 2 weeks postpartum was my first one. And I remember just being feverish and feeling so ill. And it prompted me to look into my own sleep, look into her sleep. And I kind of went down a rabbit hole of like Facebook groups and Reddit forums and became really passionate about teaching sleep. I ended up setting an awesome foundation for her. She like breezed through everything. There was no 4-month sleep regression. She breezed through it. And I ended up helping friends out. And then some friends were like, you should kind of do this as a job. And so I found that there is a certification process for that. And then I jumped on that. And then my son was a little bit more difficult. I don't know why per se, but I did actually have to, I said like lightly sleep train him when he was probably 10 months. And it was really just, I was nursing and he is a child that would have nursed 3 times a night, 5 times a night for indefinitely had I let him. But I knew at a certain point, we know that consolidated nighttime sleep is more important than a non-nutritional night waking. And my child's on the 90th percentile scale. I needed the solid sleep. So we did do some sleep training where it's responding in different ways. So responding with your hands and your verbal cues and things like that instead of just going right to nursing. But I would say the one thing both my kids went through was like a 2-year sleep regression. And really what that looked like was just 2 years old. We don't want to take naps anymore. So we're just going to stand up in the crib and just kind of play and yell and sing and do their thing. And we just did quiet time instead. I kind of changed the verbiage around that age where they start to become allergic to the word nap time. And so it's, okay, we're just going to do quiet time. I'm going to rest my body. You rest your body. Give them a couple of books. And the nap always comes right back. I think a lot of parents fall into that 2-year trap of, my child doesn't need a nap, we're done. And then they're falling asleep every time you're in the car or anytime they're in motion at 3, 4 p.m. And then they're staying up till 10. And then it just becomes this cycle. So keep offering that quiet time. And I will say that they napped probably off and on for a month or two before it consistently came back. And then my son now he turned 3 a few months ago, and he now is napping better than he did when he was 2. And I shorten it. It's only an hour, and I have to go wake him up because I know if I let him sleep longer, he'll have a difficult time at bedtime. Not a difficult time, but he will sit there and play and toss for an hour. And I'm like, that's not fair to him. So I know I need to cut that nap down. So he sleeps for an hour. I wake him up, but he welcomes that nap. And there was a time where he would say, no quiet time, and he would get upset with me. And it's not up to him. I know what he needs. So just like I know he needs vegetables and things that he doesn't really like, he needed that nap. And so now at 3, okay, it's quiet time, sure. And that's that.
Based on everything you know about sleep now and all you've experienced in kids, are there things that adults can learn about our own sleep or habits that we can take from teaching our kids good habits?
Yes, I think that if you're tired, your child's tired too. But when I work with families, we focus on the child's sleep hygiene. It definitely tends to have you reflecting on your own sleep hygiene. Parents always tell me that they have horrible sleep habits and they really want differently for their children. So hopefully when we talk about things like warm, dim lighting and having a dark sleep space, we do the same for ourselves. As adults, we don't really need night lights. We ideally should have a completely dark sleep space. Adults also benefit from white noise, but this means, also doing things like not falling asleep with the TV on and not leaving bright lights on.
Yeah. So how do you choose the right consultant for you? There's so many out there. I mean, I keep lists and lists that I share with parents, and I say, just call around and talk to people, see how they jive with you.
Exactly. Many sleep consultants do offer free, 10 or 15-minute get to know you calls. And that allows you to assess if you're a good fit, and same for them as well. Often by looking at someone's website or simply just following them on social media, you can really get an idea of what their philosophy is and if it jives with you.
Okay. Yeah. So you should probably go into those calls with just a few questions, like specific, just to get a feel for their answers.
Yes. And they'll have questions for you as well in terms of breaking down your child's sleep hygiene. Mm-hmm. But that is definitely a good time to ask. Every parent's big question is, how much is my child going to cry? And everyone's goal is to minimize that crying. But there are some sleep consultants who are okay with bed sharing under 12 months, for example. I myself follow the American Academy of Pediatrics guidelines regarding that. So my clients know if they're under 12 months, they need to be in a separate sleep space. So there's, again, different philosophies there when it comes to what people offer.
I want to talk about the terminology we use too, because parents are always talking about sleep training. And you just very importantly pointed out that we teach our children to sleep just like we teach them so many other things. So I don't know if I really like when parents say sleep training. I don't know. It just seems kind of top down or
it has a stigma. Mm-hmm. Yeah. Sleep teaching would be another alternative.
Sleep teaching. Yeah, I like that better. I don't know. How do you frame it for families, or do you really get into that at all? Like, I don't really sleep train. I'm your guide. I don't know. What are you?
Usually if they come to me, they're pro sleep training, but I'll get a lot of attachment parents that say, I thought I was anti-sleep training, but I'm really struggling. And I'm not the kindest person to my spouse or my child because I'm not sleeping and I need help. And I think that there is a method for everyone. If you need help, if you're exhausted, if you're exhausted, your child's exhausted too, to be honest. And yeah, there is someone for everyone, regardless of your philosophy, regardless of your parenting styles, whether you identify as an attachment parent, whether you identify as more parent-led in your relationship with your child. I firmly believe there's somebody in my field that can help you.
There are many different methods to get your child to sleep through the night. And as Lexi said, you can speak with a sleep consultant or follow one on Instagram to get a sense of their philosophy. The most important message here is that kids need their sleep, and it's our job to help guide them. And parents need their sleep so they can be the best guide to our kids in all aspects of their lives. Lexi learned much of what she knows from reading online and from following others, and that's an option for you too. I always refer parents to the website babysleep.com. It's from the Pediatric Sleep Council. The site has really short articles, really short, that address every sleep problem. And if the answer to a sleep problem isn't there, I recommend hiring a sleep consultant. You can ask your pediatrician for recommendations, or there are several child sleep certification programs that list their consultants. The Family Sleep Institute is one option, and they have a list of their consultants. Thank you to Lexi Rupert at Little Bird Sleep Consulting for sharing her insight and solutions to the most common sleep problems that I hear from parents. I love that she started her business out of her direct experience. She's been there, and I love that her very first clients were her friends and that they encouraged her to pursue this work. She started this work as a friend, and if you work with her, you will feel like she is your friend. Plus, your child's going to sleep and nap very well. We didn't go into detail about sleep training methods in this episode, but I'm going to cover that in an upcoming episode, so be sure to click the follow link in your podcast app so you don't miss it. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a question about the weird things kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.